my name is Crystal Riddle and this is Jane, and today I'm going to be talking about a general horse health check and different things that you need to be checking and looking for on your horse. So the first thing that you want to look for in a horse health check overall is the horse's general appearance. So you want to notice that the eyes are clear, the nostrils are free of any oddly colored drainage. You'll want to look at their skin and coat. Sometimes if they're unhealthy or if they're just out of shape, they'll have a really dull, kind of scratchy, sometimes bad looking coat. Sometimes they might have flaky skin. But in general, Jane here appears to be alert. Her eyes are clear. She doesn't have any unusual drainage in her nose or her mouth, and her skin and coat is nice and shiny, so it's nice and healthy. The next thing I'm going to talk about in this horse health check are the mucous membranes. There are two places you can look at the mucous membranes. Two common places are the gums inside the mouth and then the conjunctiva on the inner corner of the eye. To see the conjunctiva, what you want to do is take your thumb and just kind of pet their face to make sure they're okay with it. And then take your thumb and gently roll out to expose a nice pink, healthy conjunctiva at the inside of the eye. And to check their gums, you'll just kind of pet their face, make sure they're all right with it. And then just take your thumb and gently push up on their lip until you can see a nice, shiny, kind of sheen, pink, light pink mucous membranes in the gums. When checking the mucous membranes, particularly in the mouth when you're looking at the gums, you definitely want to check on a pretty regular basis the capillary refill at the gums. This is going to indicate a pretty consistent level of hydration. If you suspect the horse might be dehydrated, if they're not drinking, if they're kind of acting abnormal, checking the capillary refill is a good place to start. What you'll want to do is take your thumb and just gently kind of roll up on their lip and then gently press on the gums and then release. You'll notice there's a white thumbprint where you pressed, and then when you release, it should go away within 1 second or less than a second. That will indicate a healthy or a normal level of hydration. If you press down on the gums and that white spot doesn't go away or it takes a long time to go away, that could indicate a problem within the horse. Maybe they're not drinking enough, there might be an illness or something wrong with them, so you want to look further into that. While you're checking the mucous membranes, something important to look over are the color of the gums. A good color for gums, or just the mucous membranes in general, is a nice kind of lightish pink, kind of sheen or shiny type texture to the mucous membranes. If they're any color but that, I would probably say look into it and see what kind of color it is. So if it's like a fiery red color, it could indicate a fever or infection somewhere. If it was like a brick red to maybe a purpley type color, it could indicate a lack of oxygen or cyanosis. A yellow color in the mucous membranes could indicate a jaundice or maybe some kind of problem with the liver. And a pale to like a grayish white color in the gums or mucous membranes could indicate anemia or shock. The next element of horse health we're going to be talking about is a healthy pulse, or a pulse rate for the horse. A healthy pulse rate for a horse is going to be anywhere between 32 to 44 beats per minute. Anywhere between there is going to be a good sign for a pulse. How you take it, commonly it's taken under the jaw, the maxillary artery. Sometimes it can be taken at their knee, at the radial artery, and other times it can be taken down here, somewhere between the fetlock and pastern, in this area down here. Some people will take it down here, but I will explain why that's not always ideal in just a moment. Right now, I'm going to go ahead and take her pulse at the maxillary artery. I'm going to reach under here, just a little bit to the inside of her jaw to find that artery. Make sure I can find the pulse. So now the person behind the camera is going to time me for 10 seconds, and I'm going to count how many beats through her maxillary artery within that 10 seconds. So let me find it, and go ahead. Alright, so for Jane here, I counted 5 beats, so just some quick math. 5 times 6 is 30, so she's kind of right there at 30 beats per minute. That's a little bit lower than the average, but for Jane, she's a little bit older and she's not she works every day. She has a job she does, so that's not out of the ordinary for her. That's pretty average for her. So it's not low enough for me to be alarmed by any means. It's important to note that whenever you're taking a pulse or a heart rate, if you find that the horse's pulse or heart rate is above that range I mentioned earlier, that 32 to 44 beats per minute, that's definitely indicative of some kind of issue going on with the horse, whether that be like pain resulting from laminitis or colic or any other pain from any area in the horse. A lot of times an elevated heart rate could indicate pain, anxiousness, or anything that might have spooked the horse. But a lot of times if they're just in their stall and they're just hanging out, if they have an elevated heart rate, it's usually an indicator of pain. Now, as far as the digital pulse goes, that's not really an area you're going to go to try to find a regular pulse if you're just doing a horse health check. To find a digital pulse, you'll want to come down here a little bit, just right here at the pastern. You can kind of feel where that is. The only time you're going to come down here to look for a digital pulse is if you suspect that there's already something going on in the hoof. If you've got a hot nail, maybe an abscess or laminitis, a lot of times you're not going to be able to find or even discern a pulse of any kind down here unless there is pain or something wrong in the hoof structure itself. Next, I'm going to be talking about the heart rate. Something important to remember about the heart rate is that when you take the pulse and then take the heart rate, they should mirror each other. So I should get the same result from the heart rate that I got from taking her pulse. So what you'll do is you'll need a stethoscope for this part. And you're going to place the end of the stethoscope right about in here, kind of behind her elbow a tiny bit, but in her heart girth area. So I'm going to have, again, the person behind the camera time me for 10 seconds, and then whatever I count, we'll multiply that by 6. I'll need to find it first. Okay, go ahead.
Okay.
Alrighty. And it was in fact mirroring the pulse I got before. I counted 5 beats, and 5 times 6 is 30, so again, that's similar, or the same, as to what I got for her pulse.
Go.
So now we're going to be talking about respiratory rate and what kind of rate you're looking for in a normal, healthy horse. A normal respiratory rate is going to be anywhere between 8 to 16 breaths per minute. So what you want to do is kind of just stand off to the side and watch their flank area. And as you're watching for a full regular breath, you're going to see their flank rise and then fall. Sometimes if your horse like snorts or takes like a half breath, it won't extend to a full inhale. So you'll want to wait until your horse is calm and relaxed where you can actually count consistent breaths. So I'm just going to stand off here to the side and watch her flank and see if I can't find a regular breath. And then I'll have my person behind the camera count to 10. And then I'll multiply whatever counts or whatever breaths that I counted by 6. Alrighty. And go ahead. Okay. So for her, I actually counted just 2 breaths, and 2 times 6 is 12. So she falls within that normal or regular range for a respiratory rate for a healthy horse. If the respiratory rate is below or way above that regular range that I mentioned before, that is definitely cause for concern, and I would definitely get in contact with a veterinarian or emergency services for horses. Now we are going to be looking at gut sounds in regards to a horse health check. Healthy gut sounds is something that not a lot of people really consider when it comes to doing a horse health check, but this is something that's going to indicate a regular and a healthy GI tract movement. So what you'll want to do is make sure that you have a stethoscope, because you'll need that for this part. There are 4 quadrants to listen for. There's 1, 2, and then on the other side 3 and 4. You're going to want to stand off to the side and just make sure they're okay with you listening to it. What I'm listening for are just regular gurgling, popping, crackling, regular intestine sounds. So go ahead and put my stethoscope on. For this, you don't actually need to time anything. As long as you're hearing consistent noises, that's a good indication. So go ahead and check this first one. There's a lot of good consistent sounds up here. I'll go down here and check through here. There's some really nice consistent sounds on this side. And so what I'll do is head over to the other side. And the same thing, quadrant 3 and 4, I'll listen to. And some really normal, healthy gut sounds and crackling, popping noises. And there's some really good ones in there too. If you are doing a horse health check and you get to the gut sounds and listening to all 4 quadrants, if there is any situation where you may not be hearing any gut sounds at all in one or more of the quadrants, that's a pretty good indication of a colic, and that is a definite cause for concern. Sometimes if you're listening and you're not hearing like normal bubbling, cracking noises and you're hearing just like a rushing sound, almost like someone just turned on a faucet, that could indicate a hypermodal colic, and most of the time that's followed with some decent diarrhea or runny stool. So that is also a cause for concern. This next element of horse health we're going to talk about is temperature. A normal temperature range within a horse is 99.5 to 101.5. Anywhere between there is perfectly fine. There are 2 methods some people use to take temperature, and you can either use a mercury thermometer or you can use a digital thermometer. I'll be showing both. When you're using a mercury thermometer, you want to make sure that you can find the mercury, the gauge, in the thermometer, and before you use it, you want to make sure you shake it a little bit down past 98 degrees so you can get an accurate reading. So just give it a couple little flicks, and that should drop it down plenty below 98 degrees. And I'm going to use some Vaseline just to cover the tip of the thermometer to make sure that it's comfortable for the horse. Alright, so what you're going to do is just kind of pet him back here, stand off to the side so that way you're not in the line of fire if they're not particularly good about this. You want to move your tail over. What I suggest doing is having a clip at the end of your thermometer so you can clip it to the tail, so that way you don't accidentally lose your thermometer. So I'll go ahead and clip it to a piece of tail here, and then gently insert the thermometer. There we go. Alright. And if you want to stand there and hold it, you definitely can. Or since it's clipped to the tail, if you wanted to walk away and then check your pulse, heart rate, mucous membranes, anything else, you can leave it here for about 2 minutes. So that way the thermometer has time to get an accurate reading. Alright, so it's been about 2 minutes. So we're going to go ahead and take our thermometer out. I'm going to unclip the clip here. Gently take out our thermometer. And make sure you have a place that you can wipe it off so that way you can read it. I'm looking here. Her temperature is right just above 99. I would say probably 99.78, somewhere in there. So that's normal for her. That's nothing out of the ordinary. It kind of falls within that range of temperature for horses, so that's perfectly fine. So next I'm going to be talking about a digital thermometer. And what you'll want to do with that is you'll press the button on the thermometer and then insert and then wait until it beeps. You can get a much faster reading from a digital thermometer. However, they tend to read a little bit lower and they're not as accurate as a mercury thermometer. So if you can get a glass mercury thermometer, they're much more accurate, but they do take a little bit more time and they're more fragile, hence because they're glass. So I'll go ahead and pet her on the back side again, make sure she's okay with this. And for this, I'm not going to walk away without it. I'm going to stand here and wait until it beeps. Go ahead and press the button and insert. So sometimes for digital thermometers, you'll want to kind of gently lay it up against the rectal wall just to get a good reading. Go ahead and pull that out. And this is reading at about 99.1, which again is a little bit lower. It's not alarmingly low, but it's again, an accurate reading for her temperature. It falls within that normal range. If it was any lower than 99 or any higher than 101.5, then I would definitely be concerned. But this is definitely normal for Jane. All right, the last element of the horse health check we're going to be talking about is what's called the skin pinch test. This is another way to check level of dehydration. So what you do is just kind of come here, anywhere in about like this area of the neck to their shoulder. You'll grab a small piece and gently pinch, and then again gently pull up, and then release. So you'll notice her skin kind of went back into place or snapped back fairly quickly. When you have a good level of hydration or normal hydration, you'll notice that the skin will go back within a second or maybe less than a second. That's always a good sign, that's positive. If for any reason the skin, you pinch it up and it doesn't go back very quickly, it takes longer than a second to 2 seconds, or sometimes it may even tent and just kind of stay in place. That is an indication of low level hydration. Your horse might be ill, might not be drinking enough, the weather might have been changing drastically back and forth, so they don't have a normal water intake. Sometimes you might want to consider the age of your horse. If you have a horse who's considerably older, if you do the skin pinch test, sometimes it might not indicate that they're necessarily dehydrated. They're just older and they're losing the elasticity in their skin.